Last week, we reported that researchers have found a promising new way to detect if comatose patients have any awareness on what's going on around them. Dr. Karnig Kazazian says they use near infrared light to watch a patient's brain respond to a command to imagine he was playing tennis. The patient had been deemed clinically unresponsive. Dr. Kazazian says the technology could help doctors and family members across the country make decisions about whether to continue aggressive care if a patient shows signs of awareness. Dr. Kazazian joined us to share more about their research.
So I think in the paper that we have just published, there are a few key findings that I'd like to highlight. The first is that we are able to use a portable bedside imaging technique to detect preserved brain activity in patients that are in a coma after having a severe brain injury and are on various forms of life-sustaining measures, such as a breathing tube, wires, pumps, drains. The next thing is that we're actually able to use this technique to better understand if these patients can, one, hear what's going on around them, if they are able to perceive uncomfortable or painful stimuli, and then most importantly, can we detect preserved consciousness in patients that appear to be unresponsive? And we can. And I guess the main and the key finding here is that we were able to identify a patient that appeared to be entirely unresponsive based on bedside clinical examination. Yet when we asked this patient to imagine playing a game of tennis, they were able to do it consistently, repeatedly, and in a manner that was indistinguishable from a response of a healthy individual. So this confirmed to us that not only could they hear what was going on around them, but they were actually entirely aware of what was going on around them. So we used a technique called functional near-infrared spectroscopy, or FNIRS for short. And the way that this works is that you put a cap on a patient's head and you shine light into their brain. And we measure how much of this light is being absorbed by different parts of the brain and how much is being reflected. And essentially, more light absorption means more brain activity. It's portable. You can bring it to the patient's bedside, which is great. It's entirely safe. And it's a relatively simple setup. First, the most direct impact is we are able to identify preserved consciousness in patients that appear to be in a coma or appear to be unresponsive. Now, in the ICU, oftentimes after a few days, families and clinicians have to make really difficult decisions. Do you continue with aggressive life-sustaining therapy in hopes that the patient will make a recovery and go on and have a quality of life that's acceptable to them? Or do you transition a patient to comfort-focused care and have them pass away peacefully in the ICU? If a patient was known to be aware, so in other words, if we knew that they were in there based on the results of this technique, you can imagine this would greatly influence which way these decisions are going to go. Another way this can, really influence care is that we think these techniques will actually be able to tell us or predict which patients will have a good recovery versus which patients will not have a good recovery. And currently, further studies are underway to see if we can use this as a predictive tool.